You know, a cardiac emergency, it can happen to literally anyone, anywhere, anytime. And what you do in those first few minutes, that can be the difference between life and death. Seriously. Being prepared isn't just a good idea, it's everything. So, let's walk through these essential life-saving steps together.
Yeah, think about it. It could happen at home, at work, maybe even in a public park. And in those first super critical moments, before an ambulance can even get there, your actions are the single most important factor. So this explainer, it's going to be your guide to the basic life-saving steps that can literally keep someone alive.
Okay, so before we really dive in, let's just pause for a second. If someone collapsed right in front of you, like right now, what would your first 3 moves be? Just think about that. Keep those in your head as we go, and we'll see how they stack up against what the experts recommend.
All right, first things first. The most crucial step is just recognizing that you're in an emergency situation. I know, it sounds super obvious, right? But believe me, sometimes the signs can be surprisingly subtle.
So let's get really clear on what we mean by that. A medical emergency. We're talking about an immediate threat to a person's life. This isn't a scraped knee or a minor cut. This is a situation where every single second counts, especially when it's a cardiac issue.
So you really want to keep your eyes peeled for 4 major red flags. We're talking about someone having a hard time breathing, uncontrolled bleeding, suddenly losing consciousness, or grabbing their chest in really severe pain. If you see any of that, your internal alarm bell should be going off like crazy. These are the undeniable signs that you need to act, and you need to act now.
And when it comes to a heart attack specifically, there's this classic symptom that people always describe. It's not just a simple ache, it's this deep, crushing pressure. You've probably heard the phrase, an elephant sitting on the chest. It's such a powerful way to get across just how incredibly severe this feels. But here's the thing you have to remember. The pain isn't always just in the chest. It can actually travel, maybe up to the jaw or down the left arm. And you've got to look for these other key signs too. Like, are they suddenly sweating a lot for no reason? Are they short of breath? Do they feel nauseous? Any of these, but especially if you see a few of them together, that's a huge warning sign.
Okay, so you've spotted the signs. You know this is a real emergency. Now, your next step is not to panic. Your next step is assessment. Here's how you can quickly and safely figure out what's really going on.
Well, first responders have this really simple tool they use to check for consciousness. And guess what? You can use it too. It's called the AVPU scale. It's just a super quick, easy to remember way to gauge how responsive someone is.
So here's how it works. A stands for alert. Are their eyes open? Do they seem aware that you're there? Then comes V for voice. Do they only respond when you talk to them? Next is P for pain. Do they only react when you, say, give them a firm tap on the shoulder? And then, the most critical one, U is for unresponsive.
And that last letter, U, that is the big one. If you shout their name and get absolutely no response, and they don't even react to a firm tap on the collarbone, you have to assume they are unresponsive. That, right there, is your green light. It means call for help and start taking action immediately.
All right, so you've determined someone is unconscious. Your very next check is for the absolute basics of keeping someone alive. We call them the ABCs. Yeah, airway, breathing, and circulation. You can really think of these as the 3 pillars of life. I mean, if one of them fails, the others are going to follow pretty quickly. So your first job is to check each one, and fast. Okay, here's how you do that check. For A, airway, you're just looking to see if it's open and clear. For B, breathing, you're going to look, listen, and feel. Put your cheek near their mouth and look for their chest to rise, listen for breath sounds, and feel for their breath on your skin. And don't take more than 10 seconds to do this. Finally, C for circulation. Just do a quick scan of their body. Is there any major, life-threatening bleeding?
Now, if the person is unconscious and you need to check their airway or maybe give breaths, this one simple move is absolutely key. See, when someone's unconscious, their tongue can actually fall back and block their throat. So by tilting their head back and lifting their chin, you literally pull the tongue forward and open up that airway. It is such a small move, but it has a massive impact.
Okay, listen up, because this next part is so important. When someone is unresponsive and they're not breathing normally, it often means a heart attack has turned into a sudden cardiac arrest. And that means the heart has actually stopped beating. At that point, CPR, it's the only thing standing between life and death. So let's walk through the steps.
Really, it all boils down to 4 critical steps. Step 1. Always make sure the scene is safe for you first. Then, check the person and shout for help.
And here's a pro tip that is so crucial. Don't just yell, "Someone call 911." Point to a specific person. Say, "You in the blue shirt, call 911 now." This gets rid of that bystander effect where everyone thinks someone else is handling it. Once that call is made, you begin.
So you get your hands in the right position, right in the center of the chest, and you're not just pushing down. You have to understand you are literally becoming their heart. You are manually pumping oxygenated blood to the brain, to all their vital organs. Every single compression is a fight to keep those cells from dying.
And the speed here, it's absolutely critical. You've got to push hard and you've got to push fast. We're talking a rate of 100 to 120 compressions a minute. Now, how do you keep that rhythm? Here's a great little trick. Think of the song Staying Alive. Seriously, the beat is right in that perfect sweet spot. It's a simple hack, but man, it really works.
Okay, so here's the cycle you're going to follow. It's 30 compressions, deep, right in the center of the chest. After 30, you do that head tilt/chin lift and give 2 rescue breaths, just enough to see the chest rise. And then you're right back to 30 more compressions. 30 to 2, 30 to 2. You just keep that rhythm going until professional help arrives and takes over.
All right, last section. While you're waiting for that ambulance to show up, what are the simple things you should do? And maybe more importantly, what should you not do? Because these can be just as important as the CPR itself.
Let's start with the do's. This is your checklist. First, and this is non-negotiable, call for help the second you even suspect a heart attack. Then, have the person stop whatever they're doing and sit or lie down. Loosen any tight clothing, especially around their neck. Try to stay calm. Your calm can actually help them stay calm too. And finally, if they're conscious and you know they're not allergic, having them chew 1 adult aspirin can really help.
And now for the don'ts, and these are just as crucial. Whatever you do, do not ignore these symptoms or try to tough it out. And please, do not try to drive yourself or the person to the hospital. Call an ambulance. The paramedics can start life-saving treatment the second they get there. Also, don't let the person eat or drink anything, and don't give them any unprescribed medications. Just stick to that 1 aspirin if it's appropriate.
So why is all of this so incredibly important? Well, it all comes down to this idea of the golden hour. This is that critical window of time right after a cardiac event where every single second matters. Your actions, recognizing the signs, calling for help, starting CPR, you are the bridge that gets that person through those first terrifying minutes. You are their best and maybe their only chance. So the real question is, now that you know what to do, are you ready to be that chance?